prevent men from seeking help?
Well, first of all, I just want to emphasize that this is such an important topic. I want to go back 15 years to a true story of one of my patients that came in with his wife for the first time. And he was very quiet during the interview. And I asked his permission if I could ask his wife what's going on. And his wife told me that he cries at night sometimes. And I asked him, can the wife stay in the room so she could tell me more? And he agreed. And after I heard about the crying at night, I asked him if it was okay if I referred him to a therapist so they could talk to him to try to get to the root of it. And the man immediately just stood up and said, I'm not going to a therapist. There's nothing wrong with me. I'm a man. Men don't go to therapists. And I explained to the man and his wife that if he goes to a therapist, he's not less than a man. And I remember giving both of them my phone number and asking them to call me if I could make that referral. And I remember so well watching the news, WJTV, and watching a news story where he took his own life. And the research has shown that up to 70% of men in the United States will not seek therapy. And this is such an important topic, and I really appreciate you allowing me to bring this to the attention of our viewing audience.
Thank you so much for that, Dr. Quinn. What are some of the ways that we can help more men just open up and speak?
Well, we just have to dispel some of the myths that go along with men going to therapy, such as they're weak or maybe there's something wrong with them, they're less than a man, and we have to support them, offer to go with them, and just be encouraging and tell them that we respect them and help them understand that psychological problems are the same as any other problems. Like diabetes or cancer is not their fault. Sometimes people can have what's called chemical imbalances in their brain, or they can have some type of trauma that they dealt with. For instance, if they were in the military or went through some type of life-altering event like a car accident or even being robbed. I mean, a lot of people are suffering with so many problems that can be helped with therapy.
It takes a lot of courage to reach out. So either you're men or women, it's important just to reach out and seek help when you need it.
Most definitely. And then there's a number 988. Anybody can call that number. I actually called in the lab just to ask permission, and they asked that people get that number, 988. That's the suicide crisis number, and there's somebody there to help you at no out-of-pocket expense.
All right, thank you so much, Dr. Quinn, for including that last tidbit. Very helpful. Switching gears right now, 12:13. Gracie, tell us, how's the weather looking